What could save your life and the lives of your loved ones when the familiar world collapses? Imagine emergency services are overwhelmed, pharmacies are closed, and help is not coming. In that moment, your preparedness is your greatest resource. What you have before you is survival experience gathered in one place. This is your guide to action. We will put together an emergency first aid kit that will help you stay self-sufficient when you are completely on your own. If you find this content useful, hit the like button and subscribe to the channel. That is the best motivation for me to keep making more materials like this for you. The first thing to understand: your home medicine cabinet is unlikely to cover all the surprises that emergency situations bring. A bandage and a headache pill are for a world where you can go to the doctor tomorrow morning. But in our world, even the impossible can happen. Pharmacies may suddenly stop working for weeks, or there may be just one open for the entire neighborhood or city. An emergency kit is designed for complete self-sufficiency. The main lesson to learn: quantities must be larger. Not one strip of pills, but a month's supply. From this moment on, you are counting only on yourself. Any emergency situation carries the risk of injury, and the very first threat is bleeding. Here, every minute counts, so blood-stopping supplies must always be within reach, in the fastest possible access. First, a tourniquet, also known as a CAT. Its main advantage is the ability to apply it to yourself with one hand. This is critically important. Second, the Esmarsh tourniquet. This is a classic. It is cheap, but it has a drawback. The rubber can crack in freezing temperatures. It is better to have 2 to 3 of them as backup. Third, hemostatic agents, such as Telox or special hemostatic bandages. They are irreplaceable for complex wounds on the neck or groin, where applying a tourniquet is impossible. Remember, death from bleeding takes minutes. If you feel that things are going south, keep your kit within arm's reach. Once bleeding is stopped, the next task is to prevent the wound from becoming infected. This is the second step toward survival. The correct order of actions matters here. First, rinsing. Hydrogen peroxide foams well, lifting dirt from the bottom of the wound. Chlorhexidine is a universal and safe solution that you can and should pour directly into the wound. Stock up on it in large quantities. This is your primary antiseptic. Next, disinfecting the edges of the wound. Betadine, based on povidone iodine, works well here. It does not burn as much as alcohol-based iodine. 70% alcohol is also needed, but mainly for treating instruments and hands, not open tissue. And this is important. Never pour iodine or brilliant green inside the wound, only around the edges. Otherwise, you will cause a chemical burn and tissue necrosis, which in an emergency situation is essentially a death sentence. What would be the first medical item you would put in your emergency kit? Or maybe you already have something unusual in your supplies that is not on this list. Write in the comments. I read every single one. A clean wound must be covered, and you can never have too many supplies here. A single serious injury can use up several packages. Sterile bandages and gauze pads are the foundation. The pads go directly on the wound, and the bandages hold them in place. An individual dressing pack is a ready-made solution, Soviet classic or modern equivalent, with a cotton gauze pad already inside. Very convenient. Roll adhesive tape is invaluable for quickly securing dressings when there is no time to tie knots, or for creating an improvised splint. And a small but valuable tip: ordinary feminine pads are an excellent absorbent material for large, dirty wounds. They can also be used as insoles in wet footwear. dirty hands, contaminated water, constant stress. All of this will almost certainly lead to diarrhea. Does not sound scary? In an emergency situation, diarrhea means dehydration, loss of strength, and ultimately death. You need to act in 3 stages. The stop valve, loperamide or Imodium. It stops diarrhea so you can physically keep moving and functioning. In an emergency, that is invaluable currency. Sorbents, enteroscel, polysorb, or activated charcoal. They remove toxins from the body. You need a lot of charcoal, 1 tablet per 10 kilograms of body weight. Recovery, Rehydron. This is a powder for restoring salts and electrolytes. Without it, water will simply pass straight through a weakened body. Warning: do not take sorbents at the same time as other medications. They neutralize their effect. Allow a gap of at least 2 hours. Pain wraps around you, strips away your willpower and your ability to think clearly. For severe pain from injuries, you need ketorol or ketanol. These are powerful painkillers that will keep you going. For inflammation or toothache, Nimisil works well. Analgin is a cheap and accessible option found in every medicine cabinet. It works moderately, but that is better than nothing. For bringing down fever, the foundation is ibuprofen or paracetamol. All-in-one powders like Theraflu are a powerhouse for getting back on your feet quickly during flu and pushing through the day. But remember, that is not treatment. And the main principle: only bring down a fever if it exceeds 38,5 degrees Celsius. Fever is the body's protective response. It helps kill the virus. A runny nose and a sore throat are minor annoyances in everyday life. In a survival situation, they are a problem that drains your strength. That is why your kit must include decongestant drops, the simplest nafazoline, and lozenges with an anesthetic, for example, strepsils, and the survivalist's secret weapon, Tiger Balm. This inexpensive remedy based on menthol and eucalyptus has 3 uses. Its sharp scent replaces smelling salts to bring someone around. You can rub it on your chest to treat a cold, and it works excellently to relieve aching muscles. Versatility is the key to a compact first aid kit. In any emergency situation, stress is your greatest enemy. It works quietly but destructively. Racing heart, panic, insomnia, all of this depletes the body's resources. Heart drops such as Corvalol, Valacordin, or Barbavol will help relieve spasms and calm a wildly pounding heart. Sedatives, even simple valerian tablets or herbal preparations, will help maintain mental clarity. Even if you appear calm on the outside, stress is hitting your body hard. These medications are used up by the whole family very quickly, so having a strategic reserve here is critically important. This is the most serious section of our kit. Use it only when there is absolutely no possibility of receiving medical help. You need 2 types of antibiotics. Amoxiclav is a broad-spectrum antibiotic. It works against respiratory tract infections, wound infections, and soft tissue problems. Ciprofloxacin is more targeted. Its domain is intestinal infections, the urinary and reproductive system, and purulent wounds. Remember, these are not vitamins. If you have started a course, you must complete it in full, 5 to 7 days, even if you start feeling better. Otherwise, you risk growing a superinfection that is resistant to medication. Now let us move on to things that require certain skills, but can save a life in seconds. We are talking about injections. Dexamethasone in ampoules is the most powerful anti-shock agent. It restarts the body in traumatic shock and relieves Quincke's edema, a life-threatening allergic reaction. Suprastin in ampoules is also needed for rapidly stopping severe allergic reactions, especially from insect bites. Citrin or loratadine in tablets are for ordinary seasonal allergies. They do not cause drowsiness and will help you stay functional. And of course, if you are including ampoule medications, you are required to have a supply of single-use syringes in different sizes, for example, 2 and 5 milliliters. There are 3 problems that may seem minor, but are capable of completely immobilizing you. Eyes, flesh burn from fire, dust, conjunctivitis. Without your vision, you are helpless. Eye drops, such as Albucid or Tobrex, solve these problems. Teeth. Toothache wears down your mental state. Lidocaine spray or even clove oil on a cotton ball will help you hold on until you can solve the problem properly. Feet. In wet footwear, athlete's foot or trench foot develops almost immediately. This is not just unpleasant, it takes away your ability to walk. And if you cannot walk, you are a target. Antifungal ointment, such as clotrimazole, is absolutely essential here. In refugee camps, basements, and any place where people gather in large numbers, hygiene disappears first, and parasites arrive with it. Head lice, or pediculosis, is not just itching. Lice carry typhus. You need special shampoos or sprays based on permethrin. Helminths, or intestinal worms. Dirty hands and contaminated water guarantee infection. Medications like Pyrantel or Vermox should be taken by the entire family or group as a preventive measure. For skin, panthenol in spray or ointment form is a universal remedy for sunburns and thermal burns, as well as for healing minor abrasions. This is the most personally important section for you. Your entire emergency kit is meaningless if you run out of a life-critical medication. The 3-month rule applies. Pharmacies are the first to close. So if you have diabetes, thyroid problems, or any other chronic condition requiring ongoing medication, you must have a supply of at least 3 months. Insulin, L-Troxin, and any other specific medications you take. And one extremely important piece of advice: keep an emergency water reserve, at least half a liter, right inside your kit. It is there so you can take a pill when there is not a single drop of water around you. Medications are good, but without tools, they are of little use. Medical scissors with blunt tips to cut clothing without injuring the skin. Tweezers to remove a splinter, a shard of glass, or a tick. A mercury thermometer, precise and everlasting, but fragile. An electronic one. Safe, but requires batteries. Ideally, have both. Syringes in various sizes, and of course, medical gloves. They will protect you from other people's blood and contamination. So let us run through our checklist. Bleeding, wounds, stomach, pain and fever, nerves, allergies, hygiene, and most importantly, your personal 3-month medication supply. This is your survival system, but assembling the kit is only part of the job. An equally important part is learning how to use the medications, give injections, and apply a tourniquet. Always keep track of how long the tourniquet has been on, otherwise gangrene can develop. And the third part, keeping your kit in working order. Check expiration dates every 6 months. Replace anything that has expired. Only then can you be certain that when the moment comes, your kit will not let you down. I must say, this video is purely informational in nature and does not aim to encourage viewers to use medications without consulting or receiving a prescription from a doctor. By applying this information, you take responsibility for your own life. Stay safe and stay prepared. If this video was useful to you, hit the like button and subscribe to the channel. Every like helps this material reach the people who truly need it. Stay prepared, and see you in the next episode.